this summer our state did see some unsettling numbers in regards to daily number of cases and records. Moving forward, what are you going to do to help combat that and make sure we never hit that peak again?
So it's a good question. So if you look this summer, every single state had higher cases than they did last year at the same time. And you think about, okay, we have all these people that have natural immunity through infection, which is real, and which people do need to acknowledge. And then you've had huge, I mean, we have 13 million just in Florida. Nationwide, there's probably, 150, 200 million people have been vaccinated. You would think that, okay, if you're going to have a wave, it's going to be less than what you've had in the past. And so I think we just have to understand this Delta is very, very contagious. It's much more contagious than what we dealt with last summer. It's airborne, whereas when COVID first came, we were really concerned, or we thought, about respiratory droplets. That's why they would say 6 foot of social distance, because the idea was, if you're more than 6 feet away from me and I sneeze or cough, that's not going to reach you. And so you're not going to get infected. And maybe that was true at the time. Now, though, it's pretty clear that what's happening, these are aerosols that are in the air. And so particularly if you're in indoor environments, that's just something that you're going to have to contend with. And as long as people have to breathe to live, there is going to be, and it's just going to be an issue with it. And so I just think we just need to understand that and prepare ourselves as best we can. The vaccines don't stop cases, unfortunately, but they will keep you out of the hospital most likely. And if you look at the mortality for people that have been vaccinated this summer, we have had some, but it's very low. And particularly when you consider the people most at risk of mortality from COVID, 50 and above, we have like almost 85% of them are vaccinated. And so really it's that 15% over 50 who aren't vaccinated that are accounting for a disproportionate amount of the mortality. And so that's just something that's just what the facts are. So we know what the tools are, and I think the fact, you never want to go through this, obviously, but I think the fact that people, I think now understand, I think there was a belief, I never said this, but I think there was a hope from some people that because we had the vaccines that this would kind of peter out once everybody or a lot of people got vaccinated. In fact, there were some in D.C. that said if you just had 50% vaccination, you wouldn't see any more waves. Well, that obviously isn't true because we're seeing that in different places. So that's just what we're dealing with, but I think use the tools that we have, and I really believe had this early treatment been something that was much more prevalent in kind of people's consciousness over the last 6 months, I think a lot of the people that were hospitalized may have been able to not be hospitalized. Yes, ma'am.
I have a question. So this treatment is supposed to significantly alleviate symptoms quickly. Can you kind of describe in just the simplest way possible how exactly it works?
So it's basically, it's an antibody cocktail. So most people who get COVID, particularly the Delta variant, they handle it fine. Maybe you'll have a fever or whatever, but it'd be equivalent to a cold or a flu for the majority of people. Obviously young people, people who don't have any health problems. And that's because their body's creating antibodies when they get infected, and the antibodies fight back against the virus and basically keep it in check. Well, there's other people, particularly the older you get, particularly if you have health problems, particularly for people that are overweight, diabetes, the like, that if you get infected, your body may not be producing the antibodies that it needs to produce to really hold it off. And so if you're not doing that, the virus takes hold more and more, and then it gets to a point where it's really dominating you. You end up in the hospital, in the ICU. And so what this is doing is what your body's not doing naturally, it's basically substituting with these antibodies to fight back against it. There's some patients that have taken this that are real well known, where I've spoken to the physicians about it, and they said, patient X was not producing any antibodies before they did the Regeneron or before they did the Eli Lilly was used early on. Delta hasn't been as effective about it. So that's really what it is. It's arming your body to be able to fight back against the virus with these antibodies. And that's why when people say, oh man, I felt like I was on death's doorstep on Friday, got it on Friday night, and then by Sunday, I felt my symptoms resolve. That's because you weren't producing the antibodies necessary to really fight it back. Now this comes in, and it's really doing work for you. So that's just the nature of what it is. And it's people sometimes have questions about, hey, what is this? Is it safe? Is this because it is an emergency use? But the concept of monoclonal antibodies is not new. This has been done for decades for different things. This is obviously geared towards COVID-19. This Regeneron is one. It's not the only one, as I mentioned, with the Glaxo, and then the Lilly, which isn't being used anymore because of Delta. But so this is not something that is like totally new, because some people look, the Pfizer and the Moderna are mRNA vaccines, and that's a relatively new technology. So sometimes people have questions about it. This monoclonal is not really new technology. I mean, this is something that's been tried, and it's delivered in different contexts, and it is delivering here in this case as well. So